Hello, welcome to BeFit Mom's Prenatal Quick Fit for back care, align and stabilize workout with our fit mom, Jenna, who's in her 22nd week of pregnancy. We'll start the workout with a spine traction exercise. Bring both hands above your head. Hold on to your right arm near the wrist, rotate it, and then pull it straight up. Pull up again to deepen the stretch. And one more time, pulling as high as possible. Release, stay tall, and we'll do the other side. Change hands, rotate the arm, and take 3 pulls straight up. During pregnancy, the weight of the uterus compresses the spine, which can cause pain and stiffness. This simple traction exercise, which can be done daily throughout all 3 trimesters, can help you have a pain-free pregnancy. Release and repeat on both sides. Change arms, rotate it, and pull straight up. Last side. 3 pulls straight up. Release, and now we'll add on a side bend. Start as before, stretching straight up. Lift your spine up and out as you bend to the left. Keep your body weight centered over both feet. Rebuild your spine, and we'll do the other side. Stretch up, lift your spine up and out, and bend to the right. One more time each side. These traction exercises are easy to do at your desk. If you sit a lot at work, plan on doing several sets of spine traction exercises throughout your day. Your back will thank you for it. Last side. Now we'll use the chair to open up the hip flexors and stretch the hamstring. Stand to the side of a sturdy chair, right hand resting on the chair for balance. Place your right foot on the chair and make a 90-degree angle between your thigh and lower leg. Lift your left arm and rise up onto the ball of your foot. Now slowly lower down, standing as tall as you can. Now press your right foot into the chair. Maintain a long neutral spine with your bum held close. Keep your standing leg straight and strong. You can think of this exercise as being like a standing plank. Now transition into the lunge by shifting your body weight forward. Keep your back leg straight. Make one line from head to toe. The hip flexors shorten during pregnancy. This tightens the lower back muscles and misaligns the spine. These 2 easy moves can help you maintain good posture and prevent back pain as pregnancy advances. Now we'll take a hamstring stretch. Stand upright, straighten your right leg, flex the foot, and bend your supporting leg. Now hinge forward from just your hips, maintaining a neutral spine. This is one of the best hamstring exercises for pregnancy as it keeps the head above the heart to prevent dizziness and works the core at the same time. Now we'll stand up and do the other side. Walk around your chair. Left hand on the chair and place your left foot on the chair. Make a 90-degree angle between your thigh and lower leg. Lift the right arm and rise up onto the ball of your foot. Slowly lower down, standing as tall as possible. Now press your left foot into the chair. Supporting leg remains straight, spine neutral, bump pulled in close to your spine. Now transition into the lunge by shifting your body weight forward to open up the front of the hips a bit more. Make sure to keep your standing leg straight, one line from head to toe. Keep your lower back supported with your bump pulled close to your spine. Breathe into this stretch for a few more moments. Into the hamstring stretch. Stand tall, straighten your leg, flex the foot, and bend your supporting leg. Hinge forward from just your hips, maintaining a neutral spine. Breathe deeply, bump held close to your spine. Rise up to standing and we'll transition to the wall, starting with abdominal compressions or baby hugs. Stand about 4 inches away from the wall, knees slightly bent. Use your hands to gently place your spine along the wall. The back of your pelvis, ribcage, and head should all rest on the wall. Place your hands on your lower belly. Inhale deeply, and on the exhale, pull your bump as close to your spine as you can. Hold the tightness in your belly as you take 2 complete breath cycles. This exercise isolates and strengthens your transverse abdominis, which is your body's internal corset and your most important core stabilizer. Inhale to prepare, then exhale and compress your abdominal wall. Maintain the contraction as you take 2 full breath cycles. Building and maintaining strength in the transverse abdominis is important during pregnancy as it helps to prevent diastasis recti, or abdominal separation, pelvic instability, and back pain. Inhale. Exhale and compress your abdominal wall. Breathing deeply, maintaining the contraction. Exhale, release your belly. Last rep. Inhale, exhale, and compress your abdominal wall. Breathing deeply, maintaining the contraction. Exhale, release your belly. Now we'll do a set of 8 baby lifts by adding on a pelvic tilt. Place your hands on your hips, contract your transverse abdominis, and now add a pelvic tilt by pulling your pubic bone straight up and closer to your sternum. Release, and we'll do this again. Pull your bump in, take a pelvic tilt, and squeeze your abs tight. Pull your bump in, take a pelvic tilt, and squeeze your abs tight for a moment. Release, and again. So it's compress, pelvic tilt, hold and squeeze, and then release. 4th rep. Compress, pelvic tilt, squeeze your abs tight, and then release. As you do these baby lifts, make sure to keep your glutes, the back of your hips, soft, so that all the work comes from just your abs. This prenatal exercise helps to keep the abdominal wall strong and functioning properly, and is one of the few ab exercises that is safe to do right up to labor and delivery. Now we'll take 4 hip hikers on each side. Lift your right hip bone straight up and release it down. Left hip bone, lift straight up and release. Right hip bone lifts and release, and left hip bone lifts and release. 2 more each side. If your pelvis feels uneven, feel free to spend more time opening up your tighter side so that you develop even mobility on both sides of your hips. These hip hikers are ideal for relieving round ligament pain during pregnancy and can even help prevent a breech presentation. Now we'll take a neck stretch. Slide your right shoulder blade down the back as much as you can. Now roll your head along the wall to the left. Keep your right shoulder pressing downward in opposition. Make sure to keep both sides of your torso even so that you isolate just your shoulder and neck. Breathing deeply into the stretch. Release, roll back up, and we'll do the other side. Left shoulder slides down the back. Now roll your head along the wall to the right. Maintain the downward pull of your left shoulder blade. Keep both sides of your torso even, and breathe deeply. Release, roll your head back up to neutral, and we'll do this stretch once more on each side. Right shoulder blade slides down the back. Head rolls along the wall to the left. Breathing deeply. Keeping the pull of the right shoulder blade down. While this exercise doesn't look like much, as the range of movement is small, it's very effective for improving the alignment of the shoulders, neck, and head. Last side. Slide your left shoulder down. Roll your head along the wall in opposition. Maintain the strong downward pull of your left shoulder blade. Breathing deeply. Now come back up to neutral, and we'll take a series of exercises to open up the chest. Rest your fingertips on your shoulders, and then roll your arms outward, elbows staying close to your waist, to prepare for 16 gentle rotations. Rotate in to pulse, out, and out, and out, and out. 5, 6, 7, and 8. 8 more. Last rep, elbows stay out. And now start small elbow circles in an easy range of motion. Now begin to make your circles a little bit bigger. Make sure that as you do these circles, that your lower ribs stay down. Work in a range of motion that's right for your body. Now we'll stretch the chest with the arms against the wall. Bend your arms, bring your hands forward, palms up. Rotate your arms once again. Reach back, placing your arms against the wall. Compress your abdominal wall. Now begin to slide your arms upward along the wall until you feel a stretch in your chest. Make sure that your lower ribs stay down and that your shoulders don't hunch up. Pregnancy causes the shoulders to round forward and the chest muscles to tighten. And these last 3 moves will help you maintain good upper body alignment and reduce back and shoulder pain. Breathing deeply. Release. Now we'll move to the mat for a series of core stability exercises. For these exercises, you can use an optional rolled yoga mat under the heels of your hands to provide extra cushioning for your wrists. Come into the all fours position with a neutral spine, shoulders aligned over your wrists, hips aligned over your knees. Make a firm box-like position in your upper body. Compress your abdominal wall, pulling your bump closer to your spine. Slide your right fingertips forward along the mat and then lift the arm until it becomes parallel to the floor. Bring the arm back down and center your body weight on all fours. Now slide your left fingertips along the mat. Lift and come into the parallel position. Maintain for a moment. Bring the arm back down, and we'll do this once more on each side. During pregnancy, it's crucial to always keep your bump held close to your spine whenever working in any quadruped position. Last time left. Bring the arm down, and now we'll repeat this pattern with the legs. Slide your right foot along the mat. Lift the leg without moving your pelvis or lower back. Hold for a few moments, stretching your leg long. Bring the foot back in and recenter in the all-fours position. Left side, left foot slides out, lift. Stretch your leg out long. Release, and we'll do this again. Right foot slides along the mat, lift it up, stretching your leg out as long as possible. Release. Bring the foot back in, last side. Now we'll do this move with opposite arm and leg extending together. Right hand slides forward as the left foot slides back. Lift both simultaneously. Make sure to maintain the compression of your abdominal wall. Try not to wobble. Now, left hand and right foot reaching out. Make sure to keep your bump held close to your spine. Release, come back down to all fours, and we'll repeat this once more each side. Slide your right hand and left foot, lift both limbs at the same time. If you're unsteady in this move, or feel pain in your lower back, then you can go back to lifting just one leg at a time. Release, come back down to center, and we'll transition to a high plank. Tuck your toes under, lift your pelvis, and then walk your feet back a few inches. Straighten your legs, and then shift forward into a high plank position with your spine parallel to the floor, shoulders aligned over the wrists. Keep your belly tight, shoulders pulled down the back. We'll hold this plank for about 30 seconds. In the last half of pregnancy, high planks are safer to do than standard planks. Release, come back down, and we'll take a modified side plank. Sit tall with your legs to the right side, left wrist on the end of your rolled yoga mat. Lift your hips up and make one line from your knees through your head. Extend your right leg and lift your right arm up to the ceiling. We'll hold this side plank for about 30 seconds too. Make sure that your bump stays pulled in and that your shoulders stay pressed down the back. Try to lengthen your spine and reach your arm and leg out as long as possible. Release, come back down to sitting. Bring your rolled mat and legs to the other side. Lift your hips up to the side, making one line from your knees through your head. Extend your left leg and lift your left arm up to the ceiling. Hold this side plank for about 30 seconds. As before, make sure your bump stays pulled in and your shoulders press down your back. Release, and come back down to sitting. This concludes BeFit Mom's Prenatal Quick Fit for Back Care, Align and Stabilize workout. Thanks for exercising with us today. Make sure to download the other workouts in this series from our website so that you can have a fit, healthy pregnancy and bounce back fast.